Hello and welcome everybody. I'm Anthony Gonzalez and I'm the Senior Program Coordinator with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I want to welcome you all today to our webinar titled Trends in College Student Substance Use. Who, what, and how did the pandemic affect us? Featuring Dr. Ty Schepis. Before we get started with today's content, I do just have a few housekeeping slides I'd like to share with everybody. Here on the screen should look semi-familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout the live session. We just kindly ask that you utilize the Q&A feature. We do have the chat enabled, so please feel free to introduce yourself as well as share reflections and resources as it relates to today's content. But again, we kindly ask that you utilize the Q&A feature for any specific questions. Additionally, we have live captioning enabled for today's session. You can turn that on through your bottom dashboard. If you have any issues getting that set up, please just send me a chat and I will try my best to walk you through that process. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. We also have a few upcoming events I would love to share with everybody. Our next water cooler chat is happening next week on August 12th and is focusing on becoming professionally developed. Our next free webinar will be taking place on September 11th and is titled Assessing Learning Outcomes for Peer Educators, Insights from National Trend Data. And we have our Fall Learning Collaborative, which registration will be opening up in the coming days. It will be a one-day symposium taking place on September 17th and is titled More Than Sobriety, Building Collegiate Recovery Support for the Whole Student. And of course, we have the 2025 National Meeting taking place here in Columbus, Ohio, October 21st to 23rd. We have both an in-person and a virtual component running simultaneously. So we hope that you're able to join us either in person or virtually at the national meeting. And with that, it is my great pleasure to introduce you today, our presenter, Dr. Ty Schepis, professor at Texas State University. Thank you so much for being here with us, and it's my pleasure turning it over to you at this time.
All right, thank you all for coming. I am going to set up my screen real quick. I'm seeing all the folks who are coming into the meeting in the chat, which is awesome. Thank you for attending. I will do my best if I can, if I see questions, to kind of try and answer them from the Q&A as I go. I may not always be able to do that. It kind of depends on how many we get. So again, thank you for coming. So my name again is Ty Schepis. I'm a professor in the Department of Psychology at Texas State University. My area broadly is substance use, but I really do focus on adolescents and young adults. And then within young adults, particularly on college students, a lot of my research has looked at prescription drug misuse. That's a major focus of mine. But I've also looked at alcohol and cannabis and other drugs. And we're going to talk about all of that today. So again, you see the title up here, Trends in College Student Substance Use, Who, What, and How Did the Pandemic Affect Use? Just to sort of set the stage, a lot of actually today we will talk about what in terms of what substance is and what trends we see in substances with use. So if we weren't typically saying who before what, I probably should have put that first. And then throughout, I'll kind of interweave how we think maybe the pandemic affected things and whether those effects, those changes that we saw as a result of the COVID-19 pandemic are persisting or potentially are abating. So I want to set the stage with what I'll call the preaching to the choir slide, which is to talk about college student substance use and why we care. Again, I don't really feel like I need to belabor this slide particularly. I think all of you know why we care about college student substance use. Again, in looking at the chat and the folks who are introducing themselves, I'm seeing lots of folks who work in college substance use prevention and treatment, student affairs, dean of students office. Also seeing some folks who are more on the academic side like me. So it's awesome to have a diverse group like this. But obviously, college student substance use has both short-term, kind of near-term effects and longer-term effects. A lot of the more immediate effects are towards the top of this slide. From a college perspective, one of the most important things is that folks who engage in heavier substance use are more likely to struggle academically and drop out of school. They're also more likely to suffer sexual assault or be the perpetrator of sexual assault. Lots of other legal consequences that can be consequences you would deal with in a dean of students or student affairs office, part of the student judicial system, possession on campus, use on campus. But there are also longer term health and psychosocial consequences to college student substance use. So we're concerned about this problem both from the standpoint of trying to maximize outcomes while that student is in college, but also maximize their long-term benefits from college, from having a healthier relationship with alcohol, and if they do engage in other drug use, other drugs. So that's why ultimately we care about this. I want to very quickly talk about, this is probably not the best way to do this, but talk about the problems with the data I'm going to use today to talk about. So we have 4 national sources of data up here, and I'm actually going to use 3 of them in various slides today. So there's the National College Health Assessment. I bet many of you are very familiar with that. Comes from the American College Health Association. It is a good survey, but as all of these do, it has limitations. And a major limitation it has is that the response rates are really, really low. So by that, I mean, a university may send out to their entire student body or a subset of their student body a request to complete the NCHA. And somewhere at your average university, somewhere around 1 in 6 or 1 in 7 of those students will complete it. And I think we all know that the students who are more likely to complete it may be the ones who also are more likely to be a little more successful in college, who have lower rates of alcohol and other drug use and less heavy alcohol and other drug use. So it's not always clear how representative the NCHA is, and it changes, and this can be a good thing, about every 3 to 4 years. It's a good thing because the survey is responsive to new trends in mental health and substance use. NCAHA is not just about substance use. But it does hurt us in terms of looking at trends, in terms of our ability to look over a longer period. The National Survey on Drug Use and Health, this is a survey near and dear to my heart. I've used it a ton. Was severely disrupted by COVID. The 2020 data are not very useful, and I will not make reference to them throughout because I will use the NESDA most in this presentation. Throughout, I'm going to have just a blank space for 2020. So the data had some pretty serious problems because NESDA is a household survey, so you go into homes, you interview individuals. Well, we couldn't really do that from the middle of March on in 2020. That's a major problem. Unlike NCHA, college students are not the focus of the NESDA. And another problem I want to highlight that I will come back to when I talk about it in the slides is in 2020, and really for our purposes, 2021 and beyond, when we talk about substance use disorder, the NESDA shifted from the DSM-4 to the DSM-5. Now, diagnostically, the DSM-5 has been the paradigm for much longer than that, but NESDA took a little while to shift. So there's a lot of reason to believe, including work that we've done, that rates of substance use disorder jumped simply as a part of that change from DSM-4 to DSM-5. We'll talk about that. Monitoring the future, we're going to talk about, we'll use that a lot when we talk about trends by sex at birth. So we'll talk about this sample. Monitoring the future for our purposes starts with high school seniors and then follows them every 2 years thereafter. So it does get a sample of college students, and many high school seniors go on to college, but not all of them, even if the majority probably do. So college students aren't the focus. With that said, of all the surveys, the monitoring the future is the most consistent. So that does have real value, and we can look over a much longer period of time than we can with our other surveys. One I'm not going to use that you may have heard of is the Healthy Minds Survey. It has really limited measures of substance use, and it's kind of hard to access. So is the Monitoring the Future for that. But quickly, before I get into learning objectives and then the data, I do want to say, if you have data from your local institution, that can be one of the most important sources that you can use in comparing to national figures and into understanding how potentially things have changed at your local institution over the past, say, 5 years, over the period perhaps since the onset of the COVID-19 pandemic, to understand also potentially if initiatives at your local institution are affecting alcohol and other drug use. So while I'm not going to talk about local data here, I also want to highlight it as an extremely important resource at that institutional level and would urge all of you to take advantage of it. Again, even if it is your local NCHA data, which still will have some problems, it gives you a better picture of your campus than anything else will. Okay, so briefly, the learning objectives. I think all of you saw these potentially when you signed up, but we are going to talk about trends in college student use of alcohol, cannabis, and nicotine, and we're going to focus primarily on those because those are the three most commonly used substances in college students. So while I might argue that an opioid, whether it's a medication or an illicit opioid, could have a much more severe impact on an individual college student, across the college population, alcohol and cannabis exert the most negative impacts by far, just because of the large population engaged in their use. We'll also talk about less commonly used or misused drugs like prescription medications. And I do want to talk a little bit about psychedelics because I think there's a lot of interest in those. And there's been some questions about whether use rates on those have changed in the past few years. And then towards the end of the presentation, we will talk about subgroups of college students who are at higher and lower risk for substance use. I'm really going to focus on sex at birth and then race, ethnicity. And throughout, again, I want to keep an eye on how potentially COVID-19 may have disrupted college student substance use and whether things are returning to the patterns that we were observing pre-COVID-19. Okay, so let's start with alcohol. Alcohol is by far the most commonly used substance among college students. And again, this is data from the National Survey on Drug Use and Health. It's actually from a paper that I was a part of. I did the analyses for with colleagues primarily at the University of Michigan. And we looked at trends in college students. Again, these are all college student data. Occasionally, I'll point out some non-college data, but it's only in comparison to college students. So you can always assume it's college students. And what you see here is a pretty stable trend for alcohol use in the past year without a use disorder. That's that gold line at the top. Rates of past year alcohol use without a use disorder hovered from 2002 to 2019 between about 60 and 65%. But what's interesting is if you look further down, around 2007, 2008, and then really at the beginning of the 2010s, you see a divergence in trends for abstinence, which steadily increased, and then alcohol use disorder, which steadily decreased. So that is a nice sign that at least our most severe manifestations of alcohol use in college students have become less common. So what's probably going on here, if we're interpreting this, is that folks, some proportion of folks who would have had an alcohol use disorder, and again, it went from about 20% to less than 10%, so over half of them probably didn't just stop using entirely, they probably continued to use, but at less frequent, less severe levels, so that they went to that use without use disorder group. And then about 10% of the folks in that group shifted into being fully abstinent in the past year from alcohol use. And I always like to emphasize when I talk to undergraduates, I think the assumption is that everybody drinks in college. And what you can see here is that about 3 in 10 college students don't. And certainly if we were looking at the past month, it would be a much higher proportion of college students. So abstinence has gone up, and that's a good sign. Alcohol use disorder has gone down, also a good sign. Okay, so then let's focus in on this comparison that looks at 2019, and then 2021, 2022, and 2023. Again, this is the National Survey on Drug Use and Health, so we can't really use those 2020 data. They're problematic. But what you see, if you just take a quick look at it, is that, again, abstinence jumped up from 2019 to 2021. That's good. That continues that trend of increasing rates of past year abstinence. It's come down slightly in the years after 2021, although I wouldn't read too much into that. But what you also see is this humongous jump in alcohol use disorder. And that alcohol use disorder jump, I cannot emphasize enough, is largely, if not solely, a function of alcohol use disorder being now captured by the DSM-5 and not the DSM-4. Colleagues and I did some research looking at a different sort of focus, but parents who have children in the household and their rates of substance use disorders. And we looked at that change from DSM-4 to DSM-5, and we found just that change in the same sample increased rates of substance use disorder by about 70 or 80%. So that's probably what you were seeing here, is not actually a jump in alcohol use disorder. It's that DSM-5 is more inclusive. What I think, if I was urging you to take something away from this, what I would urge you to take away from it is the idea that there are more students than maybe we previously thought, if we were just looking at alcohol use disorder, who have a problem in need of intervention. And I did see a quick question in the Q&A about whether that could have anything to do with changes in student demographics. It absolutely could. You know, we do see that. So I have a rising high school senior. And one of my favorite things to impart to him is that college, on average, college students have a higher proportion of female students than male students. And female students do tend to use alcohol at lower rates than male students do, but we're going to talk about this in a minute. Those gaps are narrowing, if not completely going away. So there could be some kind of socio-demographic changes that are driving at least some of this, but I think that COVID-19 is a really big change for international students. That was sort of a follow-up. I'll try and answer that really quickly before we move on. I'm not aware of humongous changes in international students. I'm certainly not seeing them locally. And with the new administration, that seems like that would go away. I think international students could drive a little of this, but it would really depend on where they're coming from. And the alcohol use environments and the social norms around alcohol use in those environments. If you, and again, this is where I would refer you to your local data, if you are at an institution that has a high proportion of international students who come from environments where alcohol use is frowned upon for religious reasons or cultural reasons, that absolutely could drive changes that you're seeing at a local level. So some of that's really going to depend on your local institution. I think college-wide in the United States, I would ascribe changes more to COVID than to anything else. Okay, so binge alcohol use, I also want to talk about changes in binge alcohol use. And what you see here is the same positive sort of trends. In 2006, 45.2% of college students, that's a humongous number, engaged in binge alcohol use in the past month. So this isn't past year now, this is past month. And you see a steady decline, little blips that go up and down. Again, year to year, if you see small changes, I wouldn't read too much into that. What we're interested in is overall this trend from 45% to about 32.5% in 2019. And then you see a further drop to less than 3 in 10, 27% in 2021, 28% in 2023. Again, that could tell us that rates are starting to return to somewhat more pre-COVID levels, but I wouldn't read too much into that, again, on a year-by-year basis. So I think overall what we're seeing with alcohol is increasing abstinence and decreasing really severe or heavy use. And that is good. I think this reflects larger societal trends towards alcohol and attitudes towards alcohol. About, it's going to date me, nearly 2 decades ago, when I was postdoc, I was doing work in local schools in Connecticut. And we were really seeing increased skepticism about alcohol and its safety that you would not have seen necessarily 10 years prior. So I do think, again, this is probably reflective of larger societal trends that we are happy to take advantage of with that shock of COVID-19. Okay, so next up, I want to talk about cannabis. And with cannabis, we see a slightly different picture. Although if you look at this slide, you're not going to see a ton of change. You're going to see rates of abstinence that were near 70% that are more like 65%. Is that any kind of stable change? Not really. You also don't see major changes in cannabis use disorder. So what we're seeing is, unlike with alcohol, much higher rates of overall abstinence, but also unlike with alcohol, we're not seeing major shifts in abstinence, in a use disorder, in use without the use disorder. All of this is relatively stable despite the changing societal norms around cannabis and the changing legal environment for cannabis. Now, obviously, even within that legal environment, many college students would not be able to legally use. It's 21 or older in states where it is legal recreationally. So we're not seeing that kind of, or I should say, the legal status of cannabis is not uniform across college students. There's a question about kind of, I think, broader trends in use with legalization. The answer is kind of complicated. And I think some evidence indicates that legalization does increase use. Some is a little less clear. I think the consensus would be that in that states that have recreational cannabis laws, they do see an increase in use. There's a real debate about whether that trickles down to adolescents, and the evidence is more mixed on that. But in adults, I think we are seeing that. But our college students are complicated because they straddle that legal prohibited line because many of them are not 21 years of age. So even in recreational states, they may not legally be able to obtain it. But there are concerns about recreational states having increased overall volumes of cannabis and access to cannabis that then does trickle down. And again, in adolescents, the evidence is kind of mixed overall. All right, so for use trends more recently, if we look at 2019, and then we look at 2021, 2022, and 2023, I have somewhat worse news than we had for alcohol, which is that we don't really see increases in abstinence related to COVID-19. There's not that increase in abstinence from 2019 to 2021. Rates there are relatively flat. You do see 2022 has a little bit of a dip, but I wouldn't read too much into that. Again, with these increases in cannabis use disorder, at least some of this is due to the change from DSM-4 to DSM-5. A good part of it probably is. But even if we're accounting for 70% increases, this is more than a 70% increase. If you look 2019 to 2023, that's more than double. That is a much larger increase. So that is a real problem. Another question that I see in the Q&A is the question about hemp-derived cannabis products like Delta-8 and Delta-10. The person who asked it talks about Delta-8. They're very accessible in Wisconsin. So I'm in Texas. I'm a native Texan, so if I make fun of Texas, I get to do that, and we need to be made fun of. We have some fun political things going on right now. I'm just going to move on. Texas is obviously not a state where cannabis is legal, but Texas is a state, like all others, because this was the federal farm bill that made hemp-derived cannabis products legal. Texas does have legal hemp-derived cannabis products and they seem to be pretty common. That's all pretty anecdotal. The question was, do we have data on those hemp-derived products? And the answer is we really don't. And I'm going to get to that actually in my future directions gaps. But one major gap that we have is in terms of other cannabinoids, Delta 8, Delta 10, people who just use cannabidiol and don't use other derivatives from cannabis. We don't know a lot about that, especially at a college student level. And that's a pretty big gap that it would be important to know, because as the person asking the question was sort of getting at, that person's from Wisconsin, and those hemp-derived products are very common there. They're pretty common in Texas, and it's probably an area where cannabis use is increasing, and there's concerns about, is that the gateway to more severe cannabis use? We don't know. We really don't know the answer to that, and I think that's something that folks are studying in an ongoing fashion, but really don't know the answer to. So a lot of folks, this slide is a little funky, my apologies. A lot of folks use cannabis in a variety of different formats. Obviously, when I was growing up, it was just smoked cannabis. There might be a little bit of edible cannabis, but a major way people use cannabis now is to vape it. So this is supposed to be past your vaping of cannabis. Actually, I believe it's 30-day vaping of cannabis. And what you can see is that the majority of people who use cannabis do so in a vaped sort of format. So this is, again, the 2021, 22, and 23 data. I've got to explain this one a little bit more. But what you see is that almost 19% of college students have vaped cannabis recently in 2022 and 2023, which then composes the majority of folks who've used cannabis in kind of any fashion. That is a very common form of cannabis use. But also, to get at that question of hemp-derived products, we don't really have very good data on vaped cannabis. We have some. We don't have good data on edibles, on gummies, on these different routes of distribution, ways to use the drug that would be important to know, because they all do have different risks, and they all have different abilities, especially vaped cannabis, for instance, to be hidden. We've all passed people who are vaping, whether it's on campus, it's illegal here. It's against regulations, I should say, here at Texas State to vape on campus. And it's probably the same in many of your institutions, but maybe you just step right off campus, somebody's vaping. We can't really know what that person's vaping. It's really hidden and impossible to know. And so I think that's another area sort of where we have a pretty big gap. Okay. So this is cannabis vaping from the Monitoring the Future. And I want to point this one out. Our blue line are college students. Our green line are non-college students. And what you see is that over the past 5 years, from 2019 to 2023, these are somewhat older data. This is the newest report from the Monitoring the Future, the 2024 report. You do see an increase of 4.2%. But that is significantly outpaced by the increase in non-college students of nearly 12%, which is a pretty alarming jump in 30-day cannabis vaping. So you really do see a jump. And incidentally, if you look at these numbers, and remember the numbers I just talked about from the National Survey on Drug Use and Health, they do differ. Some of that's just the nature of the survey and the populations they reach. It's hard for us to really know what the truth is. And my advice is always basically to average. But we are looking here in 2023 at college students. Roughly speaking, 1 in 7 have vaped cannabis in the past month. So that's a real concern. Okay. Another concern is the use of alcohol and cannabis together. And this comes partially from work that, again, I did. There was that 2021 paper I referenced with colleagues at the University of Michigan. We did it up to 2018, so I pushed it forward to 2023. And this is alcohol in the past year, alcohol and cannabis co-use, and then use disorders. So this is not what we in the research community call simultaneous use of two drugs at the same time, or at least such that their effects overlap. you could have somebody who regularly uses alcohol and then every once in a while separately uses cannabis, and they would be in that kind of turquoise colored bar that is co-use. But the big trends I want to point out from pre to post COVID, because again, we've got that break in 2020 for COVID, is that abstinence actually jumped. The most common profile from 2015 to 2019 in college students was use of alcohol only in the past year, not use of both, not a use disorder. And you see that the most common profile, not by a ton, but the most common profile is for abstinence from 2021 to 2023. What we also do see, again, though, are jumps in cannabis use disorder and both alcohol and cannabis use disorder that are not necessarily matched by alcohol use disorder. Remember, though, this is when we changed from DSM-4 previously to DSM-5 in 2021 to 2023. That accounts for the jump. So what's really probably going on here is that cannabis use disorder either went up slightly or remained stable. Alcohol and cannabis use disorder together either went up slightly or remained stable. But alcohol use disorder may have even gone down. And you'll notice in 2023, rates of just having cannabis use disorder are almost equal to rates of just having alcohol use disorder. I got a question in the Q&A about what the sample sizes are that are kind of based on these prevalence rates. Typically, the National Survey on Drug Use and Health is going to have 2,000 to 3,000 college students each year that are providing data. And then they're weighted in a way that's intended to be representative of the US population. So it is a decent sample size, but certainly compared to something like the NCHA, which has a huge sample, it's not quite the same. I think that, again, I tend to trust the National Survey on Drug Use and Health data a little bit more, but at your local institution, you definitely want to be looking at whatever sources of data you can get your hands on. Okay, so that's alcohol, that's cannabis. Let's do our third major drug, which is nicotine. As we know now, nicotine is primarily vaped. When I was growing up in the substance use research and treatment world, we were doing smoking cessation and it was combustible cigarettes. Vaping did not even exist. And I actually kind of got out of tobacco use research, and my big regret is not leaving at least a toe in there because I didn't know vaping was coming. If I ever portray myself as being able to read the future, just remind me you didn't see vaping coming. And I would say, you're right. I can't see the future. I have no idea. But on nicotine vaping, I've got good news for college students, but not for non-college students. Again, college students are our blue line. Non-college students are the green line. Non-college students had a massive increase in nicotine vaping from 2017 to 2023. Over a quarter of them have vaped in the past 30 days. Whereas for college students, you see a pretty big jump from 2017 to 2018, a smaller jump to 2019, and then it really just flattens out. And actually, you see no significant change between 2019 and 2023, and hopeful signs that maybe nicotine vaping is actually declining in college students. And I will say anecdotally, I live in a college town. Texas State University is in San Marcos. It is totally a college town. And I live in San Marcos. And when I'm out and about and I see college students, I feel like I anecdotally see fewer of them vaping than I did 4 or 5 years ago. So it does seem like either rates have flattened out or maybe even, again, we're starting to see some level of declines. All right, our one time to use NCHA data, this is for any nicotine use. Another problem that I do have with NCHA data is that they look at lifetime and then 90 days. 90 days is a pretty broad sample. Lifetime to me is not super meaningful. Sometimes people become somewhat involved in substances in high school, and then they go into recovery. They stop using, never use a thing during college. So that lifetime is not necessarily informative. when we're looking at college students. But I still include it here because the data are there. But what you see with nicotine are a real rosy, I would think, set of numbers in the NCHA, where you go from about a third have used in their lifetime to closer to a quarter from 2019 to 2023. And you see for past 90-day use, less of a decline. So it seems like what we may be shedding in those lifetime use folks are folks who would use infrequently. Just FYI, that asterisk by fall 2020, that was an exceedingly small sample in the fall of 2020. COVID was still raging. I would take those numbers with a slight grain of salt, but they do fit in with the overall trend, so I'm not as worried about them. So looking at smokeless use, so there's a question about data on college student use of specific nicotine products like pouches. The data from the NESDA over here on smokeless use do include pouches. That is intentional, but it also doesn't separate it out from other oral forms of use, like chewing tobacco, like snuff. Depending on your environment, there may be a lot more smokeless use. There may be a lot less smokeless use. That tends to vary a lot. But again, you do tend to see, as we've sort of seen for cannabis, as we've seen less for cannabis, I should say, but much more for alcohol, a real shock, a real drop from COVID-19, but some evidence, at least that past year, use rates for smokeless tobacco have started to inch back up. With 3 years of data, I wouldn't worry about that too much, but we don't know. So we see smokeless, but again, that's another good area where our data aren't great if you really want to get into very specific forms of use, like those nicotine pouches that are getting a lot more attention, a lot more marketing, and could be more of a problem. There's also a question about non-college youth who use and enroll in college in the coming years. I personally don't worry about that too much because most college students still, in most college environments, and again, this really depends on your college environment, come straight out of high school or they transfer after doing some work at a 2-year college. And so there's still pretty traditional age for a college student. If we're concerned about non-college young adults, because when I do the non-college folks, it really is young adults who are comparable in age to that college age frame. By the time they might be enrolling, perhaps in their mid to late 20s, if they come back to university, that's also, though, when a lot of folks are seeing declines in use. And in a lot of cases, if folks are engaged in heavier use, that's not really consistent with them going back to college. So I'm not personally too worried about vaping rates going up from non-college students coming into that college environment that we would have seen from that monitoring the future slide. I would be more concerned just that use of a lot of these sorts of things can be sort of cyclical. And I think we're seeing a little decline in vaping, and we just want to make sure that that decline continues. That's what I would be much more focused on personally. All right, let's shift gears entirely to a few more less commonly used drugs, if I can. And I want to start with, again, my area of expertise, which is prescription drug misuse. Prescription drug misuse, what you see here is, first of all, I would hope we're all aware of this. Unlike in a non-college environment, prescription stimulant misuse is by far the most common form of prescription drug misuse among college students. Opioids and then benzodiazepines, drugs like Xanax that are used for anxiety or sleep, are less common, but still obviously somewhat problematic. This is past year. Past year can be once in the past year, it can be a few times. So we don't necessarily know how common those are. But again, that 2020 data are missing because it's the National Survey on Drug Use and Health. You see a real decline in prescription drug misuse across classes. And we've seen this in high school seniors. We've seen this across all secondary school students. So 8th, 10th, and 12th graders. That's from that Monitoring the Future data where they look there in very big samples. And we really think that this may tell us something about at least one driver of why rates of use of various substances have declined, which is that we're seeing, and this is in 12th grade students, but a lot of these 12th grade students are going to go on to college. This is about as close as I can get developmentally with this kind of data. We're seeing real increases in high school seniors saying it's hard to impossible to get my hands on a prescription stimulant, even if I wanted one. Not all of these students do, but you're seeing this increase, and this data are from that 2024 paper I was a part of. We saw some real increases in people, if they're going to engage in misuse, misusing their own medication, not necessarily related to not necessarily getting it from another diversion source. And it's getting harder to get. That's specifically for stimulants. There's a question about, these trends in prescription drug misuse potentially related to increased awareness about fentanyl and fentanyl overdose. I think the answer kind of depends on where the person is getting their drugs from. I absolutely think it plays a role because I'm also part of a group that's doing some prevention work in local schools. And we're doing prevention work specifically around fentanyl. And we're going into the schools talking about pressed pills and how folks don't know what's in a pressed pill. And you see just a ton of agreement. You see students, again, these are high school students, but 12th graders, 11th graders, who absolutely, they take it for granted that they don't know what's in a pressed pill. And there does seem to be increased skepticism of those sorts of drugs. I will say I'm not sure that applies to stimulants, though. Even though stimulants absolutely, if it's a pressed pill, can be adulterated and not be a stimulant, I think that's opioid specific. So if I can quickly go back a slide, I think that's a lot of why you're seeing opioid rates. Look at 2023. Only 1 in 100 college students had misused an opioid medication in the past year. I absolutely think that's driving opioid declines in prescription drug misuse. I think for stimulants, it's more about availability. I think for alcohol and cannabis, there's a heavy social component too, where you want to use with peers. And certainly for COVID, we've become a little more atomized. And I think that use in groups has become a little, not a ton, a little less common. So I think that plays a role as well. All right, psychedelics. Quickly, this is lifetime use of psychedelics. We don't have great data on psychedelics, but I do want to point out a few things. One is that kind of lighter golden bar, that's psilocybin. And this is, again, in lifetime use, but you see a real jump pre to post-COVID that probably does reflect that increased interest in psilocybin from a variety of different viewpoints. Obviously, there's interest in psilocybin in facilitating therapeutic interventions, but I think that has trickled into the wider consciousness in the same way that I think there has been increasing use of cannabis because of perceived medical benefit. There may be some perceived medical benefit and perceptions of lower harms from using psilocybin. You also see it, although it's much lower, kind of in ketamine potentially. That's much lower. I would take that with a little bit of a grain of salt. The only other one I would point out for lifetime, and then we'll look at past year, is MDMA, where you do see, especially from 2021 to 2023, evidence of year-on-year declines. And that's interesting and something we should follow. I do think MDMA may have sort of peaked in the middle of the previous decade as a drug on college campuses. That still does not mean it's an uncommon drug to see used. It just may have peaked a little bit. And that's something that's interesting and worth watching. For past year use, again, you see the MDMA, you see a real drop after COVID-19. You may notice the one bar that's missing. I'm a little mad. Give me one sec. At the National Survey on Drug Use and Health, because they don't have data for past year psilocybin use. It'd be really interesting to see. That's a huge gap. We just really don't know. But we do see declines in past year use of LSD, declines that may have kind of leveled off. Again, year to year, I would be skeptical of reading too much in year to year. In MDMA, but again, past year use of ketamine has kind of inched up. And I do want to use the word inched because starts at extremely low rates and only goes up to about 1 in 200 students. Last drug I want to talk about before we talk about who and sort of those sex and racial ethnic differences are illicit psychostimulants. So cocaine and methamphetamine. So I've got lifetime and past year for each of these. And so what you see, obviously, methamphetamine is not a commonly used drug among college students. If a college student is engaged in methamphetamine use, it is a really huge warning sign that probably tells you they're using other substances as well. High rates of substance use disorder, it's a red flashing light. Cocaine use is a little bit less so, although certainly is still a real reason for concern. But you do see in both cases a bit of a decline, especially if you look at those past year numbers from that pre to post COVID environment. And again, I think some of that is access and availability. I also think some of it is maybe some decreases in social use and fewer opportunities to use with peers. And so you do see, hopefully, trends that will continue to go down or at least not come back to pre-COVID levels for cocaine, because that's a really concerning form of substance use. Okay, so with that, let's talk about sex of birth and race ethnicity and differences in college student substance use. So let's talk about alcohol. I mentioned that for alcohol, you do see changes related to sex. You see overall great evidence of these declining trends that we saw in our previous slides, just separated by sex. This is 30-day alcohol use. And you see both men and women declining. But what you see that is interesting is that at this point, for at least the past 4 years, women are more likely to drink alcohol than men are. And so that is a major interesting point, and a point potentially of education for folks. These sex differences really have declined. We're seeing it also if you break it down sex by ethnicity. I'm part of some work. I'm a mentor to a colleague of mine who does awesome work on Latino and Latina alcohol use. She's particularly focused on Latinas. And we found that we do see that sex gap, that gender gap, really narrowing. And it particularly did so in Latina college students, where their rates went up while Latino male college students kind of went down, was really concerning. I did get a question in the chat, or the Q&A, that I just want to address real quick about whether we're going to look at Greek life and athletics. There is some data maybe from the NCHA that would help you look at that, but that requires you then to get into the nitty gritty data, and you have to get access to it. You can't just look at that. The monitoring the future data have some on that, but you also then have to get into the nitty gritty data. Unfortunately, I'm not going to be able to present that data today, but that's another important sort of set of subgroups that we would definitely want to look at. So sorry, unfortunately, I'm not going to be able to do that today. Okay, so looking at cannabis use sex differences, again, what you see is if you look back in the 80s, gap narrowed somewhat in the late 80s and early 90s, but then expanded, and you see a real stable male-female difference in 30-day cannabis use until about 2016, when rates even out, and then you see virtually no differences. And if you look in that box in the top left-hand corner of the figure, you can see that men did not evidence significant changes over a 10, 5, or 1 year period, but women did, with a significant increase over a 10-year period, again, narrowing that gender gap. So these stereotypes that women use substances at lower rates are really no longer applying, and that includes with college students. If you look then at cannabis vaping, you do see a more stable sex difference and no differences, no trends really, no significant increases. This is 30-day cannabis vaping. But you do see in both men and women a degree of increase that is absolutely concerning and that has gone in men an almost 4% increase over the past 5 years, in women over a 5% increase in the past 5 years. A little bit of a narrowing of the gender gap, but no significant changes there. And then for nicotine vaping, we see that gender gap narrowing again in about 2021 with a significant decline in male use. It's not significant as a trend, but a pretty notable decline from 2020 to 2022 of nearly 5%, whereas over that same time period, past 30-day nicotine vaping in women increased by 3.6%. Sorry, 2.6%. Math on the fly is always dangerous. So you see that there's narrowing, although in 2023, there's a bit of a gap again. I would expect these rates to be pretty similar over time in men and women. Again, more evidence that we're seeing either declines or flattening in men over the longer term, whereas in women, we're seeing increases that tend to flatten out. That gender gap is just not really there anymore. For cigarette smoking, this is one of our greatest public health victories. I think if you look at data from 1980, 3 in 10 male college students smoked in the past 30 days a combustible cigarette. A little under 1 in 4 female college students did. And now they're both at about 4%, which is 1 in 25. That is humongous public health victory. Obviously, some of that has been replaced by vaping, which, depending on your perspective, may negate some of that victory. I think it negates some, but not all of it. I would say if someone wants to move from combustible cigarette use to vaping, that is a victory. But we do see that overall decline that is awesome to see. Okay, with the last little bit of time we have, I'm going to talk about race and ethnicity. This uses the National Survey on Drug Use and Health. And our data for this can get kind of small. We have, again, 2,000, 3,000, 4,000 college students each year, depending on the year of the National Survey on Drug Use and Health. So we do have pretty good samples, but once we get beyond white students, African American or Black students, Hispanic, Latino students, and even Asian college students, because such a large proportion of the Asian young adult population goes to college, it gets a little dicier. And you see that what I see here is that most groups did evidence some COVID-related decline. You can see that particularly in Hispanic Latino students. You see it a little bit in white students. But what I do want to point out, I did keep this group in here, even though it's a pretty small group, is our multiracial students. Multiracial individuals as a proportion of the population are one of the biggest growth groups. And they have very high rates of binge alcohol use that are concerning. So if you're looking for groups you want to target for prevention, your multiracial students need to know if you can get into student organizations and talk to them, if you can get into groups that they might be involved with and make sure that they're getting prevention messages. Those could be really high value. Because we want to make sure that they're not engaged in substance use in rates that then affect their college experience in a negative way. For cannabis use, I can't really look at multiracial students. Those estimates weren't very stable. And for our African American or Black students, they're also not super stable. That 2023 rate is a little bit iffy. But we see fewer differences here in race, ethnicity, and we see a little bit less of a COVID-related decline. So again, cannabis, I think, needs to be, I'm sure it is, on all of your radars for a substance we need to be watching out for and working on prevention messages and intervention for on that college campus environment and in college students, because use is increasing and or at least not declining in the ways that it has declined for other substances, and that is concerning. And then last up is just nicotine vaping. Again, as we get to substances that are used by somewhat smaller proportions of the population, I have to winnow out racial ethnic groups here with Asian students. Asian students are typically among the lowest risk students. Good news for them. But what you see here is an increase. I will point out that 2021 to 2022 data, the way the question was asked for nicotine vaping did change a little bit. So probably some of this is about the question. But if you look at 2022 and 2023, it's the white students who have the highest rates of nicotine vaping, and they have them pretty by far. And so that's really important when you're looking at doing vaping prevention messages, who you're potentially going to be treating and who you're going to be looking at. So I want to wrap up by talking about kind of some outstanding needs and questions that we have. I'm just going to put this up here. If you have any questions, please, with the couple of minutes we have left, throw them in the Q&A. I'm happy to answer them. But while folks are thinking about it, and again, to those of you who need to step off, thank you so much for coming. We just need better data. We really don't have good data for college students in a lot of ways, and it's a major problem. Every form of data that we have, I kind of pointed out some problems with, and we need it in larger samples. That gets to the question someone asked about how big are these samples in the National Survey on Drug Use and Health? Well, they're decent sized, but decent sized is not the same as really large and really good. And then you see all of these different, I think, gaps that we have, including data on edible products, different forms of cannabis, on nicotine pouches, psychedelics. A major one I'm interested in is different college types. 2- and 4-year college students really differ. And there is evidence that for Black or African American students who attend a historically Black or college or university, that's actually protected. They have lower rates of substance use. Data on sexual and gender minority students would be awesome, but that is getting increasingly hard to get, even as these students become a larger proportion of the population. It's getting increasingly hard to get. And then first generation students are really interesting and I think worthy of further study. Couple questions. So trends in inhalant or nitrous oxide use. I can sort of answer this off the cuff. Inhalant and nitrous oxide use are not super duper common in college students. Those actually tend to peak in adolescence and tend to kind of go down into young adulthood, although they don't necessarily go away. Nitrous oxide, again, that may be a university specific phenomenon. If you're seeing a lot of that, that may be a university specific phenomenon. One thing I would urge you to remember, though, is those of you who work in prevention or intervention, dean of students, student affairs offices, you're probably seeing the students who have the problems who are being referred for care or for sanctions. Don't overestimate the proportion of the overall population that is engaged in use. So we do want to kind of be careful there. But certainly those students who are coming to you are some of our highest risk and most in need. There's a question about whether nicotine vaping begins in high school or college. Most of it is going to begin in adolescence. By most, I would estimate that it's about 60-ish%, not all. But many to most of the students who are coming to a college environment, if they're going to start vaping, they've probably already done so. And if they haven't started vaping probably by about their sophomore, especially their junior year, they're really unlikely to do so. And then the last question that I have to answer live, and I'll turn it back over, is just data available on students sourcing prescription medications from unofficial sources. Where do these come from? We do have data available for people who engage in prescription drug misuse from the National Survey on Drug Use and Health and from the Monitoring the Future. A lot of actually a good part of my work has looked at sources. Most of it's coming from friends and to a lesser extent family. For free, they just get a pill here or there, but a lot of it's from friends. And then you see a little bit, although it can increase over the college years, purchases. Sometimes that's from friends, but sometimes that is also from dealers. Again, I think if you're seeing somebody who's purchasing medication, whether it's from a friend or from a dealer, that's a higher risk profile than someone who says, yes, I got busted misusing a stimulant. I just grabbed 2 at finals to get stuff done. That's riskier than not doing it, but the riskiest is folks who are purchasing or who are going to dealers like that. All right, I'm going to go ahead and wrap up. I think we're out of time. Thank you all for your questions and your attention. I really appreciated it. If you have questions for me, I'll leave up sort of my info here. Always happy to answer quick emails and things like that with what I know. But thank you all for having me.
Thank you so much, Dr. Schepis, for sharing of yourself and your expertise. As we've seen from all the questions and engagement, it's obviously been of great value to our audience. Of course, everybody, we have shared the session slides via a handout, so you'll have Dr. Schepis's email address if you have any questions. I am going to just share my slide quickly for just a few moments, just sharing a couple of our upcoming events. Again, our next water cooler chat will be taking place next Tuesday on August 12th, and we'll be focusing on becoming professionally developed. Our next free webinar will be taking place September 11th and is titled Assessing Learning Outcomes for Peer Educators, Insights from National Trend Data. And then we have our Fall Learning Collaborative, which registration will be opening in the coming days. It is a one-day symposium hosted virtually on September 17th and is titled More Than Sobriety, Building Collegiate Recovery Support for the Whole Student. Then we have the 2025 National Meeting taking place October 21st through the 23rd in Columbus, Ohio. We have a simultaneous virtual component, so we hope that you're able to join us either in person or virtually. And as a reminder, today's session has been recorded. You can expect to see the session recorded added to our website within 5 business days. Thank you again, everybody, for joining us, and I hope you have a great rest of your day. Take care, all.